Hello, my name is Georgia Bolin,
And I'm Megan Marshoni.
and today we will be reviewing the Rossetti Infant-Toddler Language Scale, which is a measure of communication and interaction.
The Rossetti Infant-Toddler Language Scale was developed by Dr. Louis Rossetti. It was published by Linguasystems, Inc. in 2006. The test set is $109.95, and 15 response forms is $41.95, and it's from birth to 3 years of age.
Okay, now to the rationale of the Rossetti. Historically, infant-toddler communication assessments have focused on language comprehension and language expression. As information regarding early intervention has emerged, the importance of preverbal aspects of language have come into consideration. The Rossetti was designed to provide clinicians with a comprehensive, easy to administer, and relevant tool to assess the preverbal and verbal aspects of communication and interaction. So the purpose of the Rossetti is to assess preverbal and verbal aspects of interaction and communication in young children and to help families make decisions about early intervention programs.
The Rossetti includes subdomains which assess each of the following areas of communication and interaction. Interaction attachment assesses the cues and responses that reflect a reciprocal relationship and communication between the caregiver and child. Pragmatics assesses the way the child uses language to communicate with and affect others in a social manner. Gesture assesses the child's use of gesture to express thought and intent prior to the consistent use of spoken language. Play assesses changes in the child's play behavior, reflects the development of representational thought symbolically displayed through play. Language comprehension, which assesses the child's understanding of verbal language with and without linguistic cues. And language expression, which assesses the child's use of preverbal and verbal behaviors to communicate with others using words.
Okay, so the design of the Rossetti. The Rossetti is a criterion reference, not a norm reference instrument. Criterion reference tests compare the subject's mastery of specific behaviors to the specified behaviors. Test items were designed to best reflect current information available concerning the preverbal and verbal aspects of communication and interaction in children birth through 3 years old. The child must demonstrate all behaviors for a particular developmental area within an age range before a developmental age level can be considered mastered rather than emerging.
The Rossetti includes a parent questionnaire and interview. This promotes the family's role as a partner in the assessment process. Parental report is used to obtain a broader view of the child's range of skills in different settings. It also gives the parent a time to express concerns and expectations. The parent questionnaire is included to obtain information about the child's past and present interaction and communication skills. It may be filled out prior to the assessment or used as a guide during a direct parent interview. And some example questions regarding interaction and communication development are: was your child ever separated from you for a long period of time? Did your child resist cuddling? Or was your child often difficult to calm? Some example questions regarding comprehension and understanding include: how does your child respond when you give directions? And how does your child respond to simple questions? Some example questions regarding speech and language development include: when did your child say his or her first real word? Did your child's speech or language development seem to stop for a time? And when did your child first put 2 or 3 words together?
There are no reliability and validity measures reported for the Rossetti Infant-Toddler Language Scale. However, the items developed for the scale are a compilation of author observation, descriptions from developmental hierarchies, and behaviors recognized and used in the field of infant-toddler assessment. Only items which were considered discriminating and representative of a skill at any age were included in the scale.
So, administration of the language scale. Before the assessment, review the completed parent questionnaire or any available information about the child's past and current skills to determine where to begin testing. Meet with the parents when the evaluation begins to discuss concerns, expectations, and clarify any remaining questions. Observe a time of free play to obtain a language sample, imitations, and communicative attempts. Interact with the child to elicit the items on the scale and engage the child in free play to complete the scoring. So some examples of interaction attachment are shows sensitivity to others' moods and displays fear of strangers. Examples of pragmatics include vocalizes to others and vocalizes when another person calls. Examples of gesture include covers and uncovers face during peekaboo, reaches upward as a request to be picked up, and waves high and by. Examples of play include covers face with towel during peekaboo, imitates stirring with a spoon, or pushing a toy car. Examples of language comprehension include gives objects upon verbal request, looks at person saying the child's name, understands simple questions, and identifying two body parts on self. And examples of language expression include says mama or dada meaningfully, imitates consonant and vowel combinations, uses a word to call a person, and says 1 to 2 words spontaneously. And those are all for the 9 to 12 month range.
Okay, so establishing basals and ceilings. Beginning with interaction attachment, start 6 months below the child's chronological age or suspected developmental level. If all items aren't passed, testing moves backwards in this developmental area until an age range is reached where all items are mastered. And this age range is the basal for that developmental area. Testing then moves forward until the child fails all items for a developmental area at a particular age range, which determines the ceiling for that developmental area. This procedure should be repeated for each of the developmental areas.
So for response recording and scoring, the protocols can be used up to 3 times, and it is suggested to use a different color of ink each time in order to measure changes in performance. Age levels at which all items are mastered, which is the basal, in each developmental area are entered on the age performance profile to help describe the child's performance and progress to the caregiver. Items are passed if the behavior is either observed, elicited, or reported. So if an item is observed, the examiner directly observes spontaneous demonstration of the behavior. If an item is elicited, the examiner or caregiver elicits the behavior from the child directly. And if the item is reported, a behavior is not observed or elicited during the assessment, and the caregiver is asked if the child has either mastered the behavior or if the behavior is present rarely or frequently. For older age levels, we would use a language sample to estimate the child's mean length of utterance in meaningful words, and that's required to score some parts of the language expression area. So we would have to obtain a sample of around 50 utterances when the child is engaged in free play with their caregiver, and it is also important to note the child's ability to repeat utterances.
Since the Rossetti is not a norm reference assessment tool, each individual child's performance is compared to known developmental parameters as opposed to a group of typically developing children. However, there are guidelines that may be incorporated when determining the overall severity of the child's communication delay. A child is assumed to have mild delay if the child's ceiling is 2 age ranges 6 months below chronological age expectations. A child is assumed to have moderate delay if the child's ceiling falls 6 to 12 months below chronological age expectations. And the child is assumed to have a severe delay if the child's performance falls more than 15 months below chronological age expectations.
Our impressions of the Rossetti Infant-Toddler language scale, we thought that it was not difficult to learn and all materials are organized. The Rossetti does not yield standard scores or percentile ranks, only age equivalent scores. We have learned that this may make the parent feel insecure about how their child is developing. Incorporating the child's caregiver and personal toys will help to make the child feel comfortable, which may in turn encourage the child to engage and interact more. The discussion of performance section found in the examiner's manual helps clinicians bridge the gap from assessment to treatment.
Okay, so as we said, pros and cons. The Rossetti was not difficult to learn. It includes Spanish translations. It is an important tool for helping the clinician identify the strengths and weaknesses of the child. Also, as we said, incorporating items from home would help engage the child and make them feel more comfortable. And also, the same test protocol can be used up to 3 times as the child gets older. And this will help us to track and observe their progress. And there were some cons. Some cons where it was only suitable for children birth to 3 months of age, or 3 years of age, and does not yield standard scores or percentile ranks. And since it's not a norm reference test, it would be inappropriate to use when looking at a child's performance based on the performance of other group developmental levels. All right, and thank you for your time, and thanks for watching.